नहीं.
Can everybody hear me?
आवाज नहीं आ रही बेटा.
नहीं आ रही ना.
Hello.
Hello, can
Yes.
everybody hear me?
Yes, I can hear you and
Okay.
see you as well.
Okay, so this is a 53-year-old male patient with no previously known comorbids who presented with a complaint of jaundice and weight loss history since 1 year. His ERCP was attempted 3 times in the year 2019. Each of them showed distal CVD stricture. Multiple attempts were made and stent was placed. Currently, his CT showed non-functioning CVD stent and features of cholangitic abscesses in the liver.
Okay, so you've heard the history of this patient. Most likely this is a case of distal CVD structure with cholangitis and hepatic abscesses. So I'm going to have a quick scan and then I'm going to hand it over to Dr. Shafkat, who is the trainee, and I'm going to talk him through this case. But थोड़ा सा जगह. Should I start? बिल्कुल ढीला. बस ये पता है. उधर देखो. इसको भी ठीक है, कोई ज़रूरत नहीं. Can you hear me? Can you hear me?
We are with you, sir.
Okay, but we have plenty of fluid in the stomach, so I'm trying to suck it out. Before
Okay.
giving it to the candidate, I'm going to suck out all the fluid.
So is that because the patient is obstructed?
Most likely, there has to be some kind of obstruction distally.
Yeah,
Otherwise-
this fluid is telling you that this is.
Yeah, that's right.
She's not eaten anything. It's more like.
It's more like a clay fluid or muddy fluid.
While you were screening, we saw the neck area of the
Yeah,
pancreas.
neck area, and that the
Yeah, we saw the pancreatic
the
duct.
pancreatic duct is prominent.
स्टोन था, मैंने तो सिर्फ उस वक्त देखा जब वो नीचे आ रही थी तो
लेवल अच्छी खासी एब्सेस है। हम्म हम्म ये क्यों अटक रहा है बेटा? Mm-hmm. No, stop. All yours. Okay, I've made an initial scan. I've had an initial impression what exactly the patient is suffering from. I've given the endoscope to Dr. Shafkat. He's going to make a progress. Obviously, first thing is intubation. He has done the intubation in a nice way. He has been able to go down into the esophagus. One can see that there are certain erosions in the inner lining of the esophagus. Now, he has gone inside the stomach. This is the EG junction. At the EG junction, obviously, first, this is the station number 1 where he has to make an inspection of the left lobe of liver, and he can have a look at the other segments of the liver as well. And then turning to the aorta at this junction and looking at the tail and body of the pancreas. Now, one can see that the ducts, the biliary channels are dilated, and that has got an ear as well.
Can we put Doppler on it, please?
Yes, certainly.
Flo?
Thousand. जी? This is left hepatic, that's right. This is left hepatic. This is segment 2, this is segment 3. No, this is ligamentum venosum, fissure, umbilical part. Ligamentum teres on this side. ये वाला ligamentum venosum on this side. Fine, okay. This is segment 1. This is segment 8. This one is middle hepatic vein, this one. And this is porta hepatis. This is IVC. You can see IVC coming. And as we turn clockwise from this point, first we are going to see IVC and then the abdominal aorta.
Were you able to see the abscesses in the liver parenchyma? Shafkat bhai, did you see any abscesses?
Not really up till now. But then the periportal accentuation is there.
जो लिगामेंटम वेनोजम से आप ट्रेस कर रहे हैं ना टुवर्ड्स आईवीसी, तो उस साइड के ऊपर एब्सेसेस आई हैं इन सेगमेंट 1, वो ज़रा देखिएगा दोबारा।
कुछ नहीं है।
नहीं, यहाँ पे आगे जाएं ऊपर की तरफ।
This is IVC, this is middle, this is right. 187, yeah. We don't see any abscess here, but periportal accentuation is there.
दोबारा स्कैन करिएगा पेरेन्काइमा को। There were 2 or 3 abscesses और एक हेमेंजियोमा आया है सेगमेंट ऊपर 4A में।
नहीं, मुझे नहीं लगी. To be honest, I have not seen any abscess in segment 1. Radiologists have got special eyes to pick up the things. My approach is just like Dr. Saad, pick up the major things, forget about the minor things. ऐसे कामों के लिए रेडियोलॉजिस्ट होते हैं. ओके, ये कौन सी हेपेटिक वेन है?
Can you stop here?
ओके.
Now can you see? नहीं, आपने गलत। इसी साइड में ना शफकत भाई इधर ही हैं, आप जरा इनको देख लें। Yes, now can you see?
वो ऊपर कह रही है, वो ऊपर।
ये?
ऊपर कह रही है।
I don't know. मेरा ख्याल सिंपल शैडो से कुछ भी नहीं है.
नहीं नहीं, ये नहीं। काफी बड़ी चीज़ काफी नजर आई है जो इस करते हैं ना।
But yet, to be honest, we are not able to appreciate any abscess over here. No hypolucency with ring enhancement.
नहीं, रिंग एनहांसमेंट तो अभी आपको नजर नहीं आएगी ना इसमें।
Sorry, aorta. This is aorta, and you can see the spine on the back. Okay, he has to slide forward along the aorta. These are the blood vessels coming from the aorta. He has to bring them under the transducer. Suck, 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 suck. Celiac सा उसको हाँ जी हाँ. This is the celiac celiac axis. This is the superior mesenteric coming straight. This is the celiac artery.
Bring this area of the pancreas right in the center,
Yeah.
and then you can go.
Let's go follow. This is the pancreas. Okay, solid and pepper appearance pancreas. This is the pancreatic duct. Now keep the pancreatic duct under your transducer. Go to the clockwise side to take you to the tail of the pancreas, while keeping bring the kidney down here, and spleen should be here. Okay, fine, good, 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 good. Keep coming, keep coming. Okay. This is the pancreatic duct. Okay, fine. Keep coming. This is the spleen. Fine. And
Yeah.
this is the tail of the pancreas. Okay, fine. You can go back.
The wall of the pancreatic duct is a bit.
You can go back. So pancreatic duct over here is normal. This is the adrenal.
See the little hyper, the echoic, see the lining of normally
ठीक
you
है.
don't see
Good demonstration of
right
adrenal. Okay,
left
fine.
adrenal.
Excellent. Keep going. Bring the PD back under your transducer, and from there,
Yeah, this is confluence.
this is the confluence.
Now
Yes.
you have portal vein
Now
between
go to the counterclockwise.
superior mesenteric
Yes,
vein
good.
This is the
and
fall.
first spleen.
Okay, this is the fall of the PD.
ये neck area हो गया. So you had the superior mesenteric vein here. The splenic vein comes from
4.8.
here, and you have the portal confluence here.
4.5. Okay, fine. So PD is little prominent. It's 4.5
Splenic vein will come from
at the
here,
genu.
and you will have the superior. You'll have the
Right.
You follow it more towards the right.
So this is basically the neck of the pancreas. So are we done here?
Yeah, yeah, fall.
So you have seen the pancreas, you've seen the confluence. This is the क्या करना?
ये CBD है.
हाँ, कौन सी?
ये नीचे जो है.
हाँ, but the far away is the
इसको
CBD.
scan से लगाएंगे तो डॉक्टर को नहीं.
नहीं, ये है CBD.
अच्छा,
CBD
नीचे
हमेशा ना बेग सी नजर आती है,
ये
ये वाली. तो इसको कोई ज़रूरत नहीं है इस जगह पे कंस्ट्रक्ट करने की. चलो आगे चलें. D1 क्योंकि वो है डिस्टॉर्टेड है, so you'll have to do a bit of maneuvering. In a patient who's got a distended stomach, or because there's a obstruction down in the duodenum, there's always a kind of difficulty in going into the D1. So one has to have a good endoscopic skills to go into the duodenum. Push, pull. That's how you go into the D1. No, you have to go to the duodenal apex.
थोड़ा सा और ये.
Yes. ये कोई और vessels है. This way. Okay. We are straight on to the pancreas. Yes. You can see it's the pancreas. These are okay, fine.
ये क्या
हम्म.
PD?
कौन सी?
ये ऊपर.
नहीं ये pancreas वही है ना.
हाँ जी, ये नीचे क्या है?
कौन सा ये vessels है? Vessels है. Mesenteric vessels.
इसको देखना चाहते हैं.
हाँ. तो उसको इस तरह ले जाके देखो ना, ये
ये
go in like this. Go to the apex of the duodenum, duodenal cap, D1. Go in with a long scope. As soon as you enter into the D1, you can see the liver. This side, this way.
Pose हो नहीं रही.
अपोज होने दिखाओ. Let me help. ठीक है, क्योंकि वो डिफॉर्मिटी है, सो यू फाइंडिंग इट डिफिकल्ट, यू आर नॉट एबल टू गो डाउन. ये लो. So just as Khalid says that this patient has not learned the book, so because of the deformity, we are not able to go in just as it's written in the book. We are trying to have a look at the pancreas from an angle. This is not the classical anatomy that we expect in the D1. नहीं, इस साइड पे जाओ, ये तो आप लेवर वाली साइड पे जाओगे ना. यू आर गोइंग टू, हाँ, क्योंकि हाँ ये CVD है जी, क्योंकि उसमें स्टेंट नजर आ रही है. या this is the common bile duct. You can see the linear lines inside the CVD. Just follow it down to the head region. नहीं, हाँ, go clockwise. नहीं,
लेकिन लॉस हो रही है.
लॉस हो तो उसको वहीं पे रखो. Go slow, and slight subtle turn, and keep the suction on. Big wheel up, big wheel away from you. Try to follow it. नहीं, वापस पे जाओ, क्योंकि basically we are interested in the lower end of the CVD. Now you can see the things better. Yes, good. Trace it all the way down to the head of the pancreas. This is the PD. Okay. Let's measure this. .3. Okay, this is fine. 3.3, slightly upper limit of the normal. नहीं, वापस पे, हाँ, stent पे आओ. Okay. Now, once you've seen the stent, क्या इशू क्या है इसके साथ, क्यों पंगा करते हैं? There's a stricture at the duodenum, so you'll not be able to go across the duodenal band.
D2 में नहीं जाएगा.
No, you will not be able to go into the D2. So whatever examination we have to do it in the D1. कौन सा? लिम्फ नोड है. लिम्फ नोड है, लिम्फ नोड है मोस्ट लाइकली.
पैंक्रियास के अंदर है.
देख लेते हैं. देखिए मेरे तो खैर पैंक्रियास, सॉरी, ये पैंक्रियास वही है. चलो ठीक है. ये पैंक्रियास सेपरेट है. We find something abnormal here. This is something which is not normal. ये हटाना.
We're with you.
Yes, we find something abnormal here.
There's a large lymph node there, yeah?
Yeah, large lymph node. Some. This is PD. This blood vessel. नहीं वापस आओ जहाँ पे जो.
Just for the audience, can we have flow? Just check the Doppler. When you had the ductal structures, yeah, look.
Go back in. Follow the strand. Follow the CVD down to the head of the pancreas. So suction कर लो. सक्शन ही हो आधी आधी सक्शन को आधा हाफ हाफ हाँ करते रहो ना या चलो गुड ओके. On the left hand you got the liver, on the right side you got the pancreas. So we don't want to have a look at the liver, rather we want to go to the pancreas. And in between we got the CVD, we need to concentrate on the CVD. Since the CVD has got a strand that is giving reflections, clockwise like this, just follow the ये distal जो CVD है उसको देखो. Since it's not following the classical anatomy, so it is ठीक है शाबाश. Pancreas, हाँ नीचे से portal vein. This is portal vein. This is pancreatic duct. We want to see the area here. We want to see the area here. जी हाँ ये there you see. Okay. हाँ जी. Big wheel up, big wheel down, slight rotation to the right, slight rotation to the left. कर सकते हो, बिल्कुल कर सकते हो. बैलून लगा हुआ है? लोड किया हुआ. नहीं बहुत ज़्यादा कर दिया. इन्फ्लेट डिफ्लेट लेकिन कम इन्फ्लेट कर, क्योंकि वी आर इन द कैप. वी डोंट नीड दैट बिग अ बैलून. suction. We don't need a big balloon here.
Why are we using the balloon?
Shafkat wanted to put on the balloon because he was finding it to just the tip of his endoscope. So he want a better stable position.
Okay.
So suck back.
So
back.
you can
you
use
need
the
a big balloon like this. Okay. Keep sucking. You need a smaller balloon. Personally, I don't prefer using balloon in the D1, and to be honest, with a linear scope, I don't use balloon either.
I don't use balloon either. I like you, Riaz, but I've seen some experts.
Khalid
Sometimes
likes to use a balloon.
sometimes they use it, sometimes they don't.
ठीक है. Now this is PD. We are back to the same place, but we want to see the stent and CVD coming from this direction down here. आउटलाइन करो स्टेंट की, थोड़ा सा इस साइड पे जाके फिर उठाओ. जी,
Can you switch on the flow, please? Yeah, so that's the pancreatic.
Saad, what do you want to see in the flow?
No, we just wanted, the audience wanted to see the duct and the.
Well, this is the pancreatic duct.
Yeah,
This is the portal vein.
yeah.
These are the other blood vessels which are around pancreas. Now, which one is which? To be honest, I've never thought about it, and I've never tried to trace which vessel is which. Do you do that?
No. Keep it simple is the motto.
Balloon total off करो, balloon total off करो, ताकि आपकी maneuverability easy हो. Good. Now you're in a comfortable position. ये देखो ना, ये आया अब आपका. हाँ, नहीं आप इस पे आ रहे तो basically तो you're interested in, हाँ, you're interested in the
ये स्टैंड नहीं लगा था, ये हाइपर पे.
this one.
हाँ जी, वो हाँ जी.
Yes, maybe. Maybe. But then you need to visualize it better.
ये तो लगता है डबल.
Yes, we've got another 10 cases to do.
Okay. So,
आप खुद देख करें.
okay, right. Okay.
Yeah, this is a stand.
Here we follow the stent and we are following the stent down. We are following the stent down. This is the stent, okay. I'm just trying to rotate my shoulder, and I'm going down like this into the pancreatic head.
We can't appreciate the stent lines as well as I'm sure you can from there.
Yes. Can you see now?
But we can only appreciate one
This is
line.
the stent. Yes, this is the stent. Yes.
Is the stent above the? I mean, what is the shadow that is above? Just close to your cursor. If you put a, that's vessel.
That's a vessel.
Now we can see it.
Yes.
Yeah, that's better. Can you?
Sorry.
Yeah, we can see it.
But to be honest, I
Now,
don't
now
see
you
any
can see
mass.
it even better.
Yeah. To be honest, I don't see any mass around the stent. Except for that lymph node that we are seeing.
Can you trace this stent down towards the? This may be
Because
flow.
of the deformity, I'm finding it difficult to trace it all the
This may
way
be
down.
flow
to
aa
the-
raha hai. Can you
Yeah.
have the Doppler again? This is very strange.
Yes.
Why do you have flow there as well?
No, it's not on the stent, it's around the stent area. There are blood vessels around the stent area.
Riyas, इनका नीचे का duodenal end, can you focus on that a little bit?
I'm trying to do that, but because of the deformity, I'm not able to go
Yeah,
down.
that must be the problem, sir.
This is the mechanism that I can see in this patient. Now, can you see better?
Yeah, I can. We can see that.
But still, I don't see any mass around the lower end of the stented area.
Can can we have the flow on here? The audience wants to see what
Well,
these
they
structures
want
are.
to Okay, they can switch to the next room while we try to figure out.
नहीं नहीं.
Hmm.
What we were seeing the pancreas very nicely from one area within the bulb, right?
Yeah, that's right.
But now that doesn't seem
No,
to be.
I'm trying to concentrate on the lower end of the CVD.
What I'm saying is that
we can
the
go back.
pancreatic duct should be there as well,
Yeah, that's right.
because the pancreatic duct was fairly prominent, so maybe.
Yeah, there may be something. Except that lymph node that we had seen, I don't find anything other abnormality.
I think the issue that you're having is probably you can't pull the scope back a little
Yeah,
bit
that's
more,
right.
right?
Yeah,
because
that's
the
right.
moment you do that, you fall back.
I fall back into the
Yeah,
stomach.
yeah. So that is probably the big issue, and I think is that there is. Okay, so you've almost seen it till the pancreatic mass to nahi hai.
No.
Okay, so you've only seen a big lymph node and that's it.
Yeah, that's right. That's the only thing.
ठीक है. Yeah, that's
Do you
the
want me
lymph
to
node.
biopsy that?
Do you want to?
Yeah, I think so. We
Okay.
should be doing biopsy of this lymph node.
Okay, go ahead.
This is a reasonably big lymph node.
Yeah. Sure, go ahead.
22 FNB. ठीक. Next case study. Next case study. देखो.
मशीन को कहीं रेडी रहे स्लाइड आ रही है
तो बेटा ये जो होल्ड करना
होल्ड कीजिएगा।
हाँ
स्टार्ट इट।
Maneuvering
it's a
of wheel-
very soft lymph node.
maneuvering of wheel से कर रहे हैं.
हाँ maneuvering wheel से ये
आएगा कैप लगा लीजिए।
चलो Sir, in a patient like this, how many passes will you like to make?
Riyas, usually I'm guided by what comes out and what they tell me after the evaluation. But I think, you know, with the way you went, at least 2 passes.
Yes. And
Usually 2 to 3 is what we do, but it depends on whether we've got the sample and we've got the cells on the microscope.
ever since you have switched on to FNB, do you find any difference in your yield while you were doing FNC?
Sorry?
When you were doing FNAC and now you have switched on to B,
Yeah.
do you find any difference?
Yeah, obviously you get nice core tissue with the FNB, but we still continue doing the
On-site cytology.
on-site evaluation.
I think that's reassuring because
Yeah, but it's still and reassuring. Plus, I think it's also. I feel that it's also learning for us, so
Yeah.
we continue doing.
I agree with you. So what does the radiologist think that? Is it a benign looking lymph node or is it inflammatory or
Radiologist,
neoplastic?
we'll give the mic to the. Do you think this is a benign lymph
एक तो मुझे ना इस पे डॉपलर डाल के दिखा देना लिम्फ नोड। कल जो साथ में बात हो रही थी बिनाइन और मेलिग्नेंट की, जी वो हम लोग डॉपलर पे भी असेस करते हैं, क्योंकि यूजुअली जो लिम्फ नोड की सप्लाई आ रही होती है ना, दैट इज़ कमिंग फ्रॉम हाइलम. That is normal pattern of vascular supply to a lymph node, and we categorize it as type 1 vascular pattern. जो lymphoma अभी ये देखते हैं इसका ना,
मैं भी देख रहा
अब ये हाइलम पे ही आ रहा है, so it is benign. जी, और जो टाइप 2 होगा वो भी हाइलर एसेंचुएटेड वेस्कुलर पैटर्न होता है, एंड दैट इज़ मोस्टली सीन इन लिम्फोमेटस लीजन्स. लेकिन वो थोड़ा सा जिस तरह नॉर्मल हाइलर होता है उससे ज़्यादा एसेंचुएटेड होता है. इसका मतलब आपको सेंट्रल हाइलम की वैसे नज़र आ रही है और फिर उसकी आर्बोराइजेशन नज़र आ रही है ज़रा ज़्यादा. और नंबर 3 जो पैटर्न होता है दैट इज़ पेरिफेरल, तो दैट इज़ प्योरली मेलिग्नेंट टाइप 3 वेस्कुलर पैटर्न. ये नोड हम डॉपलर ऑन करेंगे तो यू विल बी सीइंग ब्लड वेसल्स अराउंड द लिम्फ नोड पेरिफेरी के ऊपर, तो वो टाइप 3 पैटर्न है जी, दैट इज़ मेलिग्नेंट. So it is sometimes it is very difficult to differentiate between lymphomatous and tuberculous even on Doppler. Benign जो lymph nodes हैं, they just follow the normal vascular pattern. Type 1 vascular pattern उसको हम बोलते हैं, that is you see the vessel coming from the hilum and then it is dividing into tiny branches, but the pattern is not accentuated or the branches are not dilated. That is basically seen in lymphomatous or tuberculous lesions.
So how many punctures do you make, Riyas, with the FNB now?
Generally, I make 2 or 3. It all depends. I also follow your routine. As long as I'm guided by my colleague, whosoever is reading the slides. If he says that you got the core, you got the tissue, and we have got the diagnosis right on the first pass, I may stop there. But generally, minimum 2 passes we do make.
Okay.
और करना है अपने
हाँ मतलब जब तक टिश्यू नहीं आ जाते. Sir, do you want to switch to the other room?
Yeah, we can switch to the other room,
Okay,
please.
fine. Can you?
ना मीडिएशन
हाँ?
मीडिएशन दे
अच्छा मेरा सर नहीं तुमने करनी बात थी.
मैं कर
Other room is here with me.
Okay. Now I'm still on. Any question from the audience on this case? Switch off कर दो. केस ऑफ था टेंशन ना लो. क्योंकि इसने मुश्किल से वो स्ट्रेंथ को नीचे मैं लेके आऊँ ऑल द वे डाउन. और ये वाइड एब्नॉर्मैलिटी मुझे मिली थी. Pancreatic duct is prominent, I agree, but again nothing unusual, nothing abnormal except for this benign looking lymph node which is large. All other things are normal. हाँ जी वो इसको ले जाओ क्योंकि इसमें काफ़ी कुछ होगा. हम्म. वो सेंटर में ब्लड वेसल नजर आ रही है. लाओ जी
सर टिश्यू आया है इसमें लेकिन कह रहे हैं कि और
और
रिक्वायर्ड
ले लेते हैं. एक दफ़ा ना इसको सेरन के साथ फ्लश कर दें. आप
सर मैं ऑलरेडी वैसे कर
कर रहे
चुका
हैं
हूँ।
बस
जी
ठीक.
सर।
कर दिए तो बस ठीक.
Yes, sir। सेक्शन दोबारा दूँ अटैच कर
अभी ठहर जाओ.
राइट सर।
क्यों डिफिकल्टी होगी? चलो हाँ जी ऑल. अच्छा ये ना कम्बिनेशन होती है कोई इसमें कोई हार्ड एंड फास्ट नहीं है कि आपने कहना है कि मैंने खाली बिग व्हील के साथ ही करना है. एज लॉन्ग एज योर मूवमेंट्स आर मिनिमम यू कैन गो ईदर वे.
एलिवेटर पे भी स्कोप की मूवमेंट
स्कोप की मूवमेंट बिल्कुल नहीं. मतलब जैसे रोटेशन है मैं रोटेशन बिल्कुल नहीं इस वक्त करूँगा.
सेक्शन कंटिन्यू रहेगा सर। कंटिन्यू
बस ख़त्म.
ओके।
वो पिछली दफ़ा मैं लो में जाओ. Hopefully we are going to get something good. करनी बात से
कर लेते
चलो इसके बाद जो है इसी पे ये एंगल है. इसको आपने सामने रखते हैं. ठीक है. जब आपने लिया है तो उस वक्त जनरली इस डिफ़िकल्ट पोजीशन में जहाँ मेंटेन नहीं होता रख के तो उसको आप लॉक कर दो. लॉक करने के बाद फिर जो नीडल को डायरेक्ट कर दो विद द हेल्प ऑफ दिस वन एलिवेट। आ जाओ, संभालो। पेशेंट की फोटो तो नहीं खींचते? पेशेंट की फोटो तो नहीं खींचते? हाँ
अटेंडेंट हो है
हाँ
नर्स नर्स है ना,
हाँ हाँ,
वो बोल रही थी चले
अच्छा अच्छा ठीक।
और आपके लिए
हाँ जी,
निडल ही वापस चलेगी हमारी,
क्या?
निडल चलेगी आपके लिए ना।
हाँ जी, की कहते हो? नहीं काफ़ी देगा आया की है स्लाइड चेक नहीं की तो बात तुसी हाले तक ਇਹ ਦੇਖਿਆ कि काम हाँ सैंपल आ गया। आओ जी आओ।
And we,
एक
Wasim,
एक और लेना है। लो ना, शौकत ज़्यादा से ज़्यादा चीज़ें अपने हाथ से करने की कोशिश करो। अभी आप इधर देखो, अभी आप इधर देखो।
गयास,
जी जी
खालिद ये कह रहे हैं
हाँ,
कि लिम्फ नोड तो पूरा वापस आ गया है, अब उसमें कुछ बचा नहीं है।
वो तो बात ठीक है। अब सिर्फ एक मैं चाहता हूँ शफकत जो है वो एक दफ़ा कर ले तो दैट विल बी इट। दिस इज़ द लास्ट पास। ठीक है, इधर देखो घूम के। ना ना इसको इसको नहीं टच कर, दिस इज नॉट द प्लेस। ये देखो ना एक
नहीं आपके
Hold.
मुंह पे तो है ना,
ए-
जो शीट है।
ठीक है वो है ना, ये आ गई आपकी। ठीक है, इसको आपने यूँ, क्योंकि नाउ आई एम फेसिंग दिस वे, लुकिंग एट द लेशन दिस वे एंड दैट्स हाउ आई एम गोइंग टू कम।
शीट भी तो बाहर करनी है मुझे।
शीत बात करनी है, वो तो उसका ये कि ठीक है, ये आ गया, लॉक कर दिया। अब आ जाओ, डायरेक्शन ये रखो। हाँ ये हम्म, हम्म, हाँ डायरेक्ट इसके साथ। हाँ हाँ, नहीं इसको यहाँ से आना चाहिए और डायरेक्ट। हाँ हाँ गुड गुड, गो इन शार्प या गुड। हाँ हाँ बस ठीक है, दैट्स इट, गुड। ठीक है, गो इन आउट, गो इन, गो ऑल द वे। हाँ गुड, वापस। हाँ जाओ, हाँ गुड, जाओ वापस, जाओ वापस, जाओ वापस, ऑल द वे डाउन। हाँ हाँ गुड, और जाओ, ठीक, शाबाश, ऑल द वे। हाँ इसकी डायरेक्शन ऑल द वे डाउन। ठीक, नहीं इसको नहीं, छोटे व्हील को तो।
सॉरी सॉरी सॉरी, वो कर रहा मैं।
हाँ हाँ गुड, ठीक है, वापस लेके जाओ, वापस लेके। हाँ अब ठीक है, और चलो दैट्स वापस कहीं, वापस कहीं, लॉक इट। चलो इसको ओपन कर, इसको नहीं। हाँ चलो दैट्स इट। अब आप मीडिया स्तंभ को देखते हुए निकाल लें। चलो मिड में आ जाए। बस 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 देना में थोड़ा सा कोई सेडेशन देना। अब आप बस ये कुछ यहाँ पे लगा था जैसे कोई एब्नॉर्मल से, ये वाला जो है बीच में आया था, ये कुछ एब्नॉर्मल से ये लगा था। मैं आपका रिपोर्ट एक्सेंचुएशन नहीं है। ये आ गया आपका 8, आगे पीछे। ठीक है, वेरी गुड, शाबाश। लेफ्ट एट्रियम फाइन, लेफ्ट वेंट्रिकल, लेफ्ट एट्रियम, ओके फाइन। Pull back slightly and this is the place, okay, fair enough, good। नहीं, big wheel up, हाँ, अब थोड़ा सा आगे हाँ, वापस आओ, हाँ जी, हाँ, थोड़ा सा और पीछे, हाँ, ये this was the area, जी हाँ, बिल्कुल ठीक, ओके। अब एपी विंडो, हाँ जी, ये आ गया आपका एओर्टा। गो टू द आर्च, फाइंड द आर्च, स्लाइड पुश एंड, हाँ ये और जा, और ऊपर लेके हाँ हाँ, ये जब आर्च आए तो हल्का सा उससे 1 सेंटीमीटर आगे पुश करना था, ठीक है। और घुमाओ, ऊपर आओ, हाँ,
और थोड़ा सा पुश,
हाँ ये
ये आ गया। लेकिन ये
नहीं हो तो चलो दोबारा ट्राई
जगह
कर।
ये वाली, ये
या दिस इज द प्लेस।
इसको थोड़ा सा इधर से आगे करना पड़ेगा, सॉरी।
वो पेशेंट हिल गया ना,
ये
Wasim, next patient ready है?
ये ऑल्टा इस साइड पे तो ऑल्टा,
हाँ जी हाँ, तो इस साइड पे उठाओगे ना हल्का सा, एओर्टिक आर्च से आप ऊपर उठाओगे टू द क्लॉकवाइज, देन यू विल सी द एपी विंडो। ये
वाली,
ठीक है, चलो दैट्स इट,
थैंक
ये
यू
बंद
सर,
कर।
थैंक यू।